Good afternoon, and thank you all for joining us for today's webinar, which is designed to provide more information on the community and academic grants that are being made available through the Gulf States Health Policy Center for health policy research in the five states in the Gulf States region. Before we get started, I'd like to provide a few housekeeping items. First, we will request that you put your phones on mute when you join, just so that we will not be distracted by any feedback or noise in the background. Also, if you have a question, we'll just ask that you make a note of your question during the presentation and hold off on asking it until the question and answer session at the end, as we will have ample time for all of the questions and answers, all of the questions that may come through. At that time, if you do have a question, we'll just ask that you please state your name and your organizational affiliation. If you have had difficulty accessing the presentation slides or the frequently asked questions document that has been made available for this webinar, if the site is asking you for a password, feel free to enter the letters GSHPC for Gulf States Health Policy Center, and you should be able to access those materials without any difficulty. Also, we'd like to make you aware that the recording of today's webinar will be available by Monday on our YouTube channel, and we will make sure that we email that link out to everyone when it is available on the website. So with those housekeeping items in mind, I'd like to welcome again each one of you who have joined us for today's webinar. Again, we will be focusing today's conversation on the community and academic grant opportunities that the Gulf States Health Policy Center is making to advance health policy research in the 5 states of the Gulf States region. Today's webinar will be co-facilitated by the program managers of the project, the Gulf States Health Policy Center project, and my name is Ebony Bryant, and I am the program manager here at the University of Alabama at Birmingham.
Hello, I'm Isaiah Lineberry, program manager, Gulf States Health Policy Center, Bayou Clinic, Bayou La Battery, Alabama. The agenda items for today's presentation are: what is the Gulf States TCC? What is health policy research? Grant funding opportunity. We will discuss the letter of intent requirements and the full application requirements. What is the Gulf States TCC? The Gulf States TCC is one of 7 National Institute of Minority Health and Health Disparities transdisciplinary collaborative centers for health disparities research. The Gulf States TCC is in Alabama, where the green star is on the map. The Gulf States TCC is the only community-based TCC of the 7 funded. Bayou Clinic in Bayou La Battery, Alabama is the grant recipient and is a community-based organization. Gulf States TCC is a partnership to build community academic collaborations in the Gulf region, Alabama, Mississippi, Louisiana, Texas, and Florida. And the Gulf States TCC uses community-based participatory research to conduct health policy research. The community is a partner in the research. The Gulf States TCC Consortium has 3 partners: Bayou Clinic, the University of Southern Mississippi, the Minority Health and Health Disparities Research Center at the University of Alabama at Birmingham. The principal investigators, the project program directors, are Dr. Regina Benjamin, Bayou Clinic, Dr. David Butler, University of Southern Mississippi, and Dr. Michelle Martin, Minority Health and Disparities Research Center, University of Alabama at Birmingham. The National Steering Committee for the Gulf States TCC provides overall leadership. The members are Dr. David Satcher with the Satcher Health Leadership Institute at Morehouse School of Medicine, Dr. Gail Christopher, Vice President, W.K. Kellogg Foundation, Dr. Visakha Sen, scientist at the University of Alabama at Birmingham, the Gulf States TCC PIs, Drs. Regina Benjamin, David Butler, Michelle Martin, and the NIH program officers. What is health policy research? Decisions, plans, actions, or inactions that are undertaken to achieve specific healthcare goals within a society or community. It includes policy made in the public sector, city, state, or national government, in the private sector, business or industry, and in the philanthropic sector, foundations. Health policy research is concerned with how policies are developed and implemented, how groups and individuals involved in policymaking influence health outcomes, and how policies or lack of policies impact the community's health status. The RFA includes sample research questions. A state policy example: does a policy of allowing parents to check students out of school after 11 a.m. and still be counted as present contribute to increased high school dropout rate and poor health outcomes? A city ordinance example: does limiting the number of liquor stores per square foot decrease violence and domestic disturbances in a community? And an individual group policy: local fishermen used to change oil in boats by emptying the oil in the water and putting more oil into their boats. Citizens put barrels on the piers for the oil and asked the fishermen to use them. Did a grassroots policy efforts improve local water quality? Now we'll transition to the grant opportunity discussion.
So at this time, now that you know a little bit more about what the Gulf States Health Policy Center is, we will provide more information about the grant funding opportunities that we are making available to community and academic partners. The reason why we are making these grants available is really to ensure that we're improving health outcomes and health equity in the 5 states of the Gulf States region. And we provide those funds to support community-based health policy research, also to support the development of academic and community partnerships, and to provide training, mentoring, and technical assistance. We have a number of researchers who have been engaged in community-based research for quite some time, and we've had community partners who've been engaged in research for quite some time. And so often, despite their involvement in that research on both sides, there are always times where the need for additional training or additional mentoring and technical assistance is expressed. And so through this program, we are making sure that we're providing that training. This is one such training activity. We're providing that mentoring, and we're also providing that technical assistance as well. In terms of this funding, the individuals who can apply would include community organizations, and that can be a 501c3 organization or any other nonprofit organization within a local community, faculty members from any of the colleges or universities that exist within the 5-state region, and we must make sure that all of the partners for these opportunities are located in one of those 5 states as listed on slide 15. With regard to the required partnerships, any project that is submitted to our program must have at least 2 principal investigators identified. One of the principal investigators must be an academic partner, which means they must be an instructor or an assistant professor, an associate professor, or full professor at one of the universities in the 5-state region. The second principal investigator must be someone representing a community organization within that 5-state region. However, the projects are not limited to 2 principal investigators. There may be as many principal investigators as are necessary on the project, but there must be at least 2, one from the community and one from an academic institution. Additionally, it's helpful to keep in mind that all of the projects that are submitted to our program must show evidence of the academic investigator and the community investigator co-leading the project, which means that there must be evidence that they are jointly developing the application, jointly developing the budget, and also co-designing the research project. Also, if the project is funded, it is going to be required that co-leadership of the project be maintained from the time the project is funded to the time the project is terminated. In terms of how many projects that we will fund, 3 to 4 projects will be funded this year. The awards that will be made will be limited to $100,000 for the duration of each project, and the projects may last no more than 2 years. For this particular funding opportunity, indirect costs are not allowed. And if you have a question about what the allowable expenditures are on the project, you may find those on pages 5 and 6 of the request for applications. There are a number of key dates to keep in mind. First is the letter of intent due date. The letters of intent this year will be due on January 15th. And those letters of intent are due by 11:59 p.m. on that date. Any letters of intent that are received after that time will not be evaluated. Once the letters of intent are received and scored, if the projects are invited to submit a full application, those notifications will be made no later than January 30th, 2015. Full applications are due into our offices no later than 11:59 p.m. on February 27th. Those applications must be submitted electronically, and the website address where those applications must be uploaded is also included in the RFA. If the project is funded, recipients will be notified no later than May 1st. 2015, and projects will have a start date of July 1st, 2015. We recognize that the time frame between the announcement of the award recipients and the project start date is a 2-month period, but the reason for that is because all of the projects that are submitted and recommended for funding must first be approved by NIMHD before projects may commence. So we'll talk a little bit now about the letter of intent that, again, is due on January 15th. The letter of intent the letter of intent is limited to 1 page. Letters of intent that exceed the 1-page limit will not be reviewed. The letters of intent must include the following items on the bulleted list on your screen. So each letter of intent must include an academic principal investigator's name and title, as well as a community principal investigator's name and title if it's applicable. Also, there is a requirement that individuals representing academic institutions who hold the title of instructor or assistant professor must have a mentor. The mentor's name and title must also be included in the letter of intent if it applies to your particular project. Additionally, the letter of intent must include the project title and what the purpose of the study will be. You must also indicate what the specific aims of the proposed project are, as well as provide a brief timeline for your project. We allow 2 years for the projects to be implemented and for your final reports to be submitted. You are limited to that 2-year time frame, but not all projects will require the full 2 years, and that is fine. But you still must provide a brief timeline, giving us a general idea of the activities that may take place within that project time period. Also, you're required to provide us with an estimate of what your project will cost. However, your project should not cost more than $100,000. If you submit a letter of intent requesting more than that amount, the letter of intent will not be reviewed. Also, keep in mind that it is okay for your project to leverage funding from other sources, but we will just caution that if you are leveraging resources from other sources, that you should have those other resources on hand at the time that you submit your letter of intent. Also, in your letter of intent, please make sure that you provide a description of the partnership. It is okay if your academic and community partnership was formed for the sole purpose to apply for this funding, but we want to make sure that we understand the nature of the partnership and how the two entities, or at least the community and academic partners who are listed as PIs, will work together on this project. Again, the LOI must be submitted electronically on the UAB Minority Health and Health Disparities Resource Center website no later than 11:59 p.m. Central Time on January 15th, 2015. So now we'll transition to a conversation about the requirements for the full application.
We will discuss the full application requirements now. Investigators must be invited to submit a full application. Investigators should submit an NIH format application on combined PHS 398 forms at the link on the screen as a single Word or PDF file. And I will be referring to this a little later in the presentation. This site is a key site for getting your forms. Application should be single-spaced.